You unlock this door with the key of compassion. Beyond it is another world, a world of science, a world of common sense, a world of sanity. You're moving into a land of both empathy and ethics, of nutritional knowledge and empowerment. You've just crossed over into Dr. Osborne's zone. Hi, everybody. Welcome to Dr. Osborne's Zone. Today, we have a special guest, Dr. Izabella Wentz, a good friend of mine. We go back a number of years, and she's most well known. Many of you might have already heard of her for her work around the thyroid. But she has got a new book out on the adrenal glands. And so we're going to be diving into stress and why I wanted to interview her. She's got some unique approaches to what she's talking about in her new book. And, you know, one of the biggest unique approaches is a 4-week protocol to get rapid results without potentially taking hormones. And so many of you watching this, you know, you're trying to overcome, you know, adrenal fatigue or stress or whatnot. And I think you're going to take a lot away from this interview. So thank you, Dr. Wentz, for being with me today.
Thank you, Dr. Osborne, for having me. It's always such a great time to connect with you.
Well, I wrote a lot of questions down, but I've got my notebook here handy. So I'm going to go through. First, why did you write this book? Because you've been really in that thyroid realm for such a long time, and now they have expanded out. What was the genesis?
Well, full disclosure, just about everybody with a thyroid issue that I've worked with has some degree of adrenal dysfunction. And so I've been talking about the adrenals as long as I've been talking about thyroid health. I will say that my protocols have evolved with time. When I first started helping people with Hashimoto's, I would test their adrenal functions and I would look at what their cortisol patterns look like, and I would give them hormones to help them balance that out. And as time went on, some people were like, I don't want to do hormones, I can't do this, or I don't feel great with hormones, that they would have other contraindications. So then I dove into what can we do from a lifestyle perspective? And I would be like, okay, you can quit your coffee and caffeine, and let's have you sleep for 10 to 12 hours a night, take some glandulars and give them a kind of a different set of recommendations. These recommendations worked really well for me personally as a young woman without children. And then when I became a new mom and my sweet son was 8 months old, and you know, everybody, I kind of read this one book that said children sleep through the night when they're 3 months old. And I thought my son was going to do that, but he didn't read the book. So by 8 months old, I was still very sleep deprived. Sleep deprivation is one of the fastest way to get into adrenal dysfunction. And I tested my adrenals. Sure enough, I was in adrenal dysfunction. But then I was like, I don't know what to do because I can't take the hormones. I was breastfeeding. I didn't want my baby to have like chest hair, right? Like some weird thing that could happen. And I couldn't sleep for 12 hours a night because that was, part of being a parent is taking care of your children at nighttime. Couldn't like get rid of the source of stress in my life. And I couldn't necessarily give up caffeine. I was like, this is my lifeline right now. And so I had to come up with a brand new protocol that helped me restore my adrenal function and helped me go from like that survival mode into thriving in just a few weeks. And then since that time, I've piloted it with thousands of people. And most of them were not new moms. So most of them were people with Hashimoto's, fibromyalgia, other kinds of autoimmune issues, fatigue. And the program has helped them so much that I decided, okay, this needs to get out as a new book because it's a completely different approach to getting somebody out of that survival state into a thriving state. And it can work very quickly.
Well, that to me is the best part if it works fast, because a lot of people have been really struggling. Many people bounce for years from one doctor to the next, or even at home on a do-it-yourself style of program, and they still continue to struggle. There's a lot of controversy about adrenal dysfunction. I mean, outside in the medical community, right, you've got Addison's disease, which is an autoimmune condition of the adrenal glands, but most doctors will say there's no such thing as adrenal fatigue per se. And I've heard a lot of people use different languages, adrenal fatigue. You used the term adrenal dysfunction. Can you elaborate a little bit more on some of those confusing points?
Sure. And it's kind of funny because a lot of it is like a study in like language and terminology. But the term adrenal fatigue was first coined by a naturopathic doctor about 25 years ago named Dr. James Wilson. And he noticed that there was a cluster of patients who had symptoms like a mild depression, brain fog, fatigue, sensitivity to lights, salt cravings, weight gain, and brain fog, all of the things we now classify as adrenal fatigue. And he said, I think these people have some degree of issues within their adrenal glands. And this sounds a little bit like Addison's disease, but perhaps a more mild form of Addison's. And so he called it adrenal fatigue. And that term was an incredibly helpful term to categorize this pattern of symptoms. And the protocols he developed were very helpful for getting people to feel better. But yet, as time went on, I feel like we learned more about how what was actually going on with the condition. And the understanding of it these days is that the adrenal glands aren't necessarily underperforming, and they're not like damaged the same way that they are in Addison's, and they're not quote unquote fatigued. Rather, it seems to be a disconnect between the brain that tells the adrenals what to do and the adrenals, right? So there's a communication breakdown between the hypothalamic pituitary and adrenal axis. And so the term hypothalamic pituitary adrenal axis dysfunction, or HPA axis dysfunction, is more of like the scientifically valid term. It's kind of like 10 years ago, people would say leaky gut doesn't exist, but intestinal permeability does. So these days it's like adrenal fatigue doesn't exist. But if we call it HPA axis dysfunction, there's actually a ton of medical research that backs it up. And so I've kind of settled on the term adrenal dysfunction for just to be most accurate. And because hypothalamic pituitary adrenal axis dysfunction is like a lot to say, but I really don't care what people call the term. I feel like people need to know like that what they're experiencing is absolutely real. It's not just in their heads, it's in their bodies, and that there is a predictable way of getting out of it. I get very frustrated, as I'm sure when you do, when people hear like, oh, this doesn't exist, like it's all in your head. And anybody that talks about this clearly isn't, smart or hasn't, is just making stuff up. So yes, it does exist, right?
Yeah, I would agree. And I'd want to ask you too what your thoughts are on this, which is there's HPA axis communication problems, but two, in my experience, I'd like you to share yours. In some people, I question whether or not there's a dysfunction or whether there's an appropriate function, right? So like a person has a set of behaviors that is driving up cortisol or driving pressure on the catecholamines to be released from the adrenal gland in an effort to adapt to their choice. And so to me, kind of in my mind, it's like, that's not a dysfunction of the organ. That's an appropriate function of the organ in response to bad behavior from the host. Do you see that a lot in your practice? And like you mentioned, you had 1,000 people pilot this new program, and I'd just like to hear your take.
Absolutely. So I'm a big believer in adaptive physiology, and that's been my observation, is that essentially the adrenals will do what they can to help us survive. And if we're sending these kind of messages to our body through our daily habits, perhaps we're eating the wrong kind of foods, and that is causing a lot of inflammation in the body, the adrenals are going to produce more cortisol to help balance that inflammation. And so, yes, absolutely. I feel like our daily habits are going to determine what our hormones do in our body in a very adaptive, responsive process, because our hormones are there to help us live and survive. And if we send kind of the messages of like, hey, we're in survival mode, our hormones are going to release survival mode or our glands are going to release survival mode kind of hormones, right? Versus focusing on the hormones that help us repair and thrive when they're released in the right amounts throughout the day.
I'm glad we agree on that. What do you find in your practice where people go wrong? Like, are there key areas in their diet? Are there key areas in their lifestyle that are like simple needle movers, right? Not like, not like saying, okay, you got to go on a fast for 7 days and you have to only eat this, and you know what I mean? Like, there are all these kinds of weird plans and programs out there, but what in your experience are the things that if people would turn their attention toward and adjust in their choices, that could really move the needle in a quick way for them?
Definitely lowering your intake of things that are inflammatory. So for most people, it's going to be gluten and dairy. Shifting to eating more foods such as fish that have higher levels of omega-3s, focusing on getting rid of foods that really spike up your blood sugar. So I know there's a great book called No Grain, No Pain that maybe talked about that a little bit, but definitely I recommend a paleo-like and grain-free diet throughout the program, just to help with that blood sugar response. Because if we're eating a lot of sugar, a lot of carbs, a lot of grains, that's going to put us on a blood sugar roller coaster, which then makes our body respond with producing a lot of stress hormones and cortisol. And these are probably the simplest lower hanging fruits or nutrition. Everybody can focus on blood sugar balance. Eating more protein is going to be incredibly helpful for people. Generally eating better, higher amounts of good fats than most people are eating. That's going to be super helpful because that's going to keep our protein, or that's going to keep our blood sugar a bit more stable. And so we're not going to have to release some of those stress hormones to counteract for we go up and then we go down, right? And the other things, like I tell people to think about, what is it in your day-to-day life that you're telling your body that's making it feel like it needs to be in survival mode? So are you not eating enough calories? Because that could be a danger signal to your body that kind of sets off that stress response. Are you exercising too much? That can be a stress response. Are you watching the news all day that talks about all of these horrific things going on 24/7? Because that could be a stress signal in your body. And then things like sleep deprivation. Again, this is one of the fastest ways to get into that adrenal dysfunction. I feel like for most people, this is a great place to start. And if you could address these, you're going to feel a lot better and very, very quickly.
Yeah, I mean, all good advice. So in summary, low-hanging fruit, the foods that are most inflammatory in your experience, gluten and dairy, paleo-like diet might be very helpful. Watching foods that could spike or potentiate a spike in the blood sugar, not eating enough, exercising too much, all things that are free for the most part that anyone could start doing right away to see some change or improvement. What do you find, beyond those things? Are there certain patterns that you see that you would say are very, very common beyond the simple things that you just talked about that are big major needle movers as well in certain people?
I would say looking at some of the patterns, people typically talk about cortisol being the problem. Like, you are stressed, you produce too much cortisol. And that gets a lot of attention. Cortisol can cause you to store belly fat. Cortisol can cause you to gain weight. And you see, all these headlines about how bad cortisol is. And I feel like people need to know that that's not always the thing. And they don't always need to focus on lowering their cortisol per se. They need to focus on the root cause of why cortisol is out of balance, which is, why are you so stressed? And interestingly, cortisol is a hormone that we need to survive. And so we need to have it released in the right amounts throughout the day. What I've seen in my experience is that, yes, some people can have high cortisol. Some people can have normal cortisol, but then it's just released at the wrong times of day. We're supposed to have more cortisol in the morning so we can wake up bright-eyed and bushy-tailed, and we're supposed to have less cortisol at night so we could fall asleep and get restful sleep. Some people have a flipped cortisol curve where in the morning time, they have low cortisol, so they feel like zombies getting out of bed, right? In the evening is where they're like, wait a minute, I got my second wind, and they're not ready to go to bed, or they have unrefreshing sleep. And then I also see patterns where people have low levels of cortisol. In fact, this has been a pattern in about 60% of people that I've worked with hypothyroidism. And it tends to be more common in people with fibromyalgia, chronic fatigue syndrome. And these are the people that will wake up in the morning and they're like, I don't know who I am, where I am. They're tired throughout the day. They're tired at night, and they hear these things like, you're supposed to get more sleep. They're like, I sleep like 10 to 12 hours. I'm still tired. They hear that they're supposed to be fasting. They try fasting. They feel worse. They hear that exercise will make them feel better. They'll try to exercise and then they'll have to recover for a few days after the exercise. And then, they'll be like, you need more time with people and time with your community. And they'll go out and spend time with other people. And they'll be like, I need like a week off from all of this action, because their body just doesn't have enough of that cortisol, which helps us deal with day-to-day stress, and everything feels overwhelming to them. So I've seen individuals who are stuck in this fight or flight stress response known as adrenal dysfunction. They can present with any of these different patterns. And it's not always like, you need to lower your cortisol. It's like, how do we let your body know that it's safe?
For those people, I'm just thinking about what the audience might be thinking in their own mind. So that person that has low cortisol morning, low cortisol throughout the day, they're just wiped. They can't exercise. They're intolerant to it. They're intolerant to being active with their communities, and they're just, any little thing wipes them out, right? Are there things that you would say, aside from what you've already mentioned, like the gluten-free diet, et cetera, are there things that you would recommend they do to help their cortisol recover? Are there certain, whether it be supplements, whether it be essential oils, or whether it be other behavioral changes or behavioral patterns, what would you say you've found to work really well?
One of the things that can help really well with this is when you wake up in the morning, making sure you have some exposure to sunshine. So stepping outside your house within the first 30 minutes and being out in the sun, that actually sends a really powerful message to through our retinas to our brain that it's wakey time. It's time to make that beautiful cortisol. When we wake up and we spend time indoors, we don't get enough of that light, right? So the indoor lighting versus outdoor lighting, that is different. So indoor, we don't have as much brightness. And so that can be a really, really powerful way to start letting your body know that it needs to produce more cortisol in the morning. And that also sets us up on a circadian pattern of, this is when it's morning. So in the evening, which evening is this is morning time, evening is going to happen in like maybe 12 hours or so. And that's when we need to have lower cortisol, and just giving your body those circadian messages throughout the day. So spending time in nature if you can. If you are exhausted, maybe just go in your backyard, sit in the shade, and put out a little blanket, right? And giving your body that opportunity to get the benefits of the bright lights. And then after dark, really focusing on not watching TV, not looking at your screens, trying to perhaps dim down the lights, whether you do that with blue light blockers or candles in your house or red lights in your house. There's different ways to make it manageable for individuals to really get your body into a great circadian rhythm of like, this is when we need to produce cortisol. I know whenever I talk about this, people are like, but I live in Alaska, or I live in this place, there is no sunshine. And so even if it's not terrible outside, you could still get that benefit, but you can also do like a dawn simulator light or a blue light inside of your house, blue light therapy box, like the seasonal affective disorder lamps, and shining that for 15 to 20 minutes after you wake up within, the presence of, you don't look straight at it, but you have it in your room. Maybe you're getting ready for the morning. That can be very helpful. Delaying caffeine by 30 to 45 minutes can be helpful to allow your body to make its own cortisol. And I also love to do an adrenal kickstart drink for people who have these low levels of cortisol. They're generally going to have low blood pressure, low cortisol, and low blood sugar. And so having something like half a cup of orange juice, coconut milk. The orange juice is going to help with the blood glucose, and it's got vitamin C for the adrenals, a little bit of coconut milk to help balance the blood sugar response from that, a little bit of protein powder to, again, help with getting your amino acids throughout the day, and some electrolytes. This can be very helpful for giving your body some of that feedback of, okay, it's time to raise up our glucose. It's time to normalize the blood pressure, and it's time to, wake up. And so you're providing your body these beautiful little feedback systems from your environment, versus if you're fasting in the morning, for some people with low cortisol, that can really confuse their circadian rhythm.
Yeah, intermittent fasting's become super popular for a lot of folks with autoimmune struggles. So what you're saying is that if your cortisol's low, that might not be the best choice for you, at least not yet.
Yes, and same with those beautiful things like exercising. If your cortisol is low, probably not the right time to train for a marathon, right? If your cortisol is low, probably not the time to go out and spend all this time extroverting if that stresses you out. I really focus on helping people tune into their bodies. We do a piece of paper. I have a little worksheet inside of the book where it's this makes me feel better. This makes me feel worse. And you really can just observe where if you feel worse when you're fasting, probably not the right medicine for you at this time, or the dose is not right. If you feel worse after exercising or a specific type of exercise, probably, not the right thing for you at this time. And so you really have to tune into your body and listen, because your body can give you powerful feedback and messages. And a lot of times people will say, I feel better spending time in nature. It's yes, that helps your body let you know that it's daytime and improve your daytime hormone production, including cortisol.
I love that you said, listen to your body, write it down, catalog it. So much information, right? I mean, this podcast, among the thousands and thousands of other health podcasts that are out there, so many people will watch them and to their own demise, right? They'll do something they heard was healthy for them, despite how it makes them feel. But what I hear you saying is you just have to pay attention, and it's your unique output that you should be paying attention to, and not necessarily even our advice. If our advice today makes you feel terrible, then obviously it's not the best advice for you as a unique person.
Absolutely. So I love coconut milk, and it can be really great for balancing blood sugar. Some people are sensitive to coconut milk, gives them diarrhea, right? Or it makes their stomach hurt. So if you're doing something and it doesn't feel good in your body, listen to your body.
Yeah, I've had so many people come to me over the years where their doctors told them that whole grain was so good for them, even though every time they ate it, they caused them massive diarrhea or massive GI pain, but they continued to put themselves through that because their doctors said, you need to do this. And so anyway, I think that to me, listening to your body is the first doctor is you, right? When your body talks to you, listen to it. And if that is working out better, but still not fully working out, then it's time to get some additional guidance. But first you have to listen to yourself and open your body up to be in tune with the symptoms that it's screaming at you.
Oh my gosh, absolutely. And that's my biggest hope for the book, is that it'll teach people to understand the messages that the body is sending to them. I have a 5-year-old son, and it's just so interesting to watch, from a parenting perspective. It's we as parents, we don't necessarily want kids to cry, right? It's doesn't make us feel so great, and they fall, and your instinct, and they start crying. And I see a lot of parents doing this, and myself, that's kind of where I want to go and say, you're fine, you're okay, you're not in pain, you're going to be okay. But it's to that child, they are scared, they're perceiving pain perhaps in a different way than we might be. They think a little scraped knee is the worst thing that's ever happened to them. It might be, right? So maybe they don't have that perspective of a 30 or 40 or 50-year-old person. And so I've just had to, it's been an amazing to reflect upon that as a person and a parent of like how disconnected we get from our bodies, right? From an early age, if we're told, no, you're not really in pain, right? Or you're over exaggerating. Maybe you're a dramatic 3-year-old or whatever. And it's like, you were just told to like slow down your roll and calm down. Like, how does this affect you as an adult? And you're like, my stomach hurts, but I'm just told to like, shut it up, right? I've been told like, it's not a big deal and to go on with my life. And a lot of it is kind of like repatterning and teaching people to be like, you know what? When you were 5 years old and you refused to drink milk, maybe you were onto something then. Maybe that milk was giving you a tummy ache, but you were socialized to say milk does the body good and it's going to help you grow and it's going to help you, get girls or get a boyfriend or whatever the messaging was. And so you drank it and you weren't listening to the messages your body sent you.
Yeah, for sure. For sure. Self-intuition is key. So let's talk about, you mentioned earlier caffeine. And one of the sections in your book is about kind of, some of those people that need to be off of caffeine who are just caffeine intolerant because they're so overwhelmed and their stress signals are so skewed. Can you walk us through a little bit about what that might look like, how to kind of taper that?
Sure. So, and I just want to say caffeine, I used to tell people at the beginning of working with people with adrenal dysfunction, you need to quit caffeine. That's what's going to heal your adrenals. And people would be like, I'm done with you. Never want to talk to you again. Right. Where's, just goodbye. Or some people would quit caffeine and they'd be like, well, I quit. I was tired and had headaches and I was waking up throughout the night and you told me it was all the caffeine I was drinking. And so I quit the caffeine. I'm still tired. I'm still waking up throughout the night and I still have headaches. But now I also hate my life. So like, what did this do to you? And so, yes, caffeine can disrupt your adrenal function. It can disrupt your sleep. It can really prevent us from feeling tired, even when we should be resting. So it puts us at risk of overextending ourselves. And I know personally, if I drink caffeine at 2:59, I will sleep really well throughout the night. If I drink it at 3:01, I will not sleep like at all the entire night, right? And so having caffeine too late in the day can sabotage our sleep. Having caffeine too early in the day can also sabotage our adrenals because caffeine naturally raises our cortisol. And so if we're getting the feedback to our bodies that we don't need to raise the cortisol by ourselves, that caffeine is going to do it for us, and the body gets into this pattern, this can sabotage our own ability to produce cortisol in the morning through that feedback loop. That being said, I don't have people do anything about their caffeine until they've really focused on re-energizing themselves. And part of this focuses on mitochondrial function, adaptogens, and connecting with the circadian rhythm first. And if after a couple of weeks on the program, you feel inspired to reduce your caffeine intake, I have a plan where we reduce it by about 25%. For some people, they can do that every couple of days. I generally will say you could do 25% every week or so if you tend to be more sensitive. That way you're really giving your body an opportunity to make its own energy so you don't rely on caffeine to make it happen for you. And this is water.
Ditto. Same here, water. No, but I think you kept a lot of viewers on the show just now, and you said I'm not necessarily taking away your coffee, right? It's And I like the way you explain that, because some people feel like they have to run out and stop it altogether right away, immediately. And then, the consequences of that could be withdrawals and could make them actually feel even worse too. So, yeah. What about, you mentioned in there as well, you said adaptogens. What, explain what an adaptogen is to our audience and why that might be helpful as well.
So an adaptogen is generally an herb, and it's a substance that helps us tolerate stress better. The beautiful thing about most adaptogens is whether you have like that high cortisol pattern or you have that flipped cortisol curve where you can't sleep at night and have no energy in the day, or even if you have the low cortisol pattern, adaptogens will adjust your cortisol pattern to what it is meant to be in a healthy person, which is higher cortisol in the morning and lower cortisol throughout the day. And the beauty of them is that they make everybody else in your life less annoying, right? So this is what they do. They take you from feeling super overwhelmed and edgy because your cortisol is out of balance to giving you a little bit more space and a little bit more resilience. And, you know, adaptogens are not the only way to do this. You can also do this with meditation, yoga. There's other kinds of personal growth strategies that can help with this. But adaptogens are definitely the quickest way and the easiest way to do it for most people. And they're generally very well tolerated too.
What are some examples of adaptogens people could try?
I love ashwagandha. I love holy basil, which can be used as like Tulsi tea. That's one of my favorite ones for, you know, people like nursing moms or people that tend to be a bit more sensitive. The beauty of it too is all of the different adaptogens have different personalities. For example, maca and shatavari are great for people who maybe have libido issues. Rhodiola can be helpful for people with like depression, anxiety, and I like Vitex for women going through perimenopause. And so there's like, you can kind of go through, and I have a list in my book, and you can say like, oh, this one has this benefit, this one has this benefit, right? And yeah, do you have a favorite adaptogen?
Honestly, I don't like them.
No?
I'm not saying I don't recommend them, because I recommend them all the time. But for myself personally, I don't like them. They've always made me feel tired and lethargic. And so I've never really particularly used them personally, but I find ashwagandha and rhodiola to be extremely helpful for people who are really, really stressed and have lost their resiliency. I also find GABA and theanine, the combination, to be extremely helpful for those individuals too. Just kind of the way I would describe it is it almost like it puts a curtain down on the back of the brain and says, no, you can't think about all this back here. You can see in front of you, and you can think about what you need to do right now, but quit worrying about all those other things. So for me, if somebody has like I no offense to any of you who might be this, but helicopter moms, there are a lot of them. And it's not because they're faulty people, it's because they just love that much. And so their minds are always racing and higher anxiety about their children. GABA in that situation, at least in my experience, is always really helpful for those individuals.
I personally love GABA as well, and L-theanine. And I find for myself, if I ever have trouble, you know, people typically talk about trouble sleeping and they'll say you should take melatonin. And I think that can be wonderful. But for me, sometimes if I have a racy mind at bedtime, or if I had that caffeine at 3:01 instead of 2:59, and I'm just going through and thinking about all the things I need to do, taking GABA at bedtime just kind of turns off that, you know, that tape recorder you have in your head that's just like, did you take out the trash? Did you do the dishes? Did you do X, Y, and Z? Did you get back to this person? And it's you know, we have so many different, I think, like you said, we have so many different protocols and options out there for people to take advantage of, and everybody might feel different depending on what their symptoms are and what their makeup is, whether or not they're going to benefit from this adaptogen or no adaptogens, perhaps, you know, utilizing some different types of neurotransmitter support like the GABA or 5-HTP or L-theanine. And I also love neurofeedback and other ways to help people feel better through just really learning how to self-regulate and calm themselves.
Yeah, I'm into that. So we talked a little bit about adaptogens, talked a little bit about exercise and caffeine. Let's talk a little bit about your priority. If you were prioritizing certain supplements to support kind of adrenal recovery, what would you say would be your big top three?
So I really focus on what are some of the common nutrients that are depleted in people that are stressed. And that's going to be the B vitamins, vitamin C, magnesium, and electrolytes. And sometimes just utilizing those can help a person's symptoms. So quickly, for my favorite way to get magnesium into a person is through an Epsom salt bath. Although for people with like constipation, I might say like, let's use some magnesium citrate. A lot of my thyroid ladies do tend to have constipation, and it's been studied in normalizing thyroid function, like on an ultrasound over if you take magnesium citrate for like many, many years. So I find when people start on magnesium, their hormones improve. They used to have PMS, and that can improve. They find that they no longer have menstrual cramps within the first month of using magnesium. They will lessen by 80 to 90%. The second month, they will have no menstrual cramps. Anxiety, sleep, all of these things just get so much better when you start a magnesium supplement, like pain in your body, headaches, sometimes migraines. All of these things. I mean, I've had countless clients that were like, I've had migraines. I'm like, magnesium. And they're like, oh my gosh, this is amazing. Or, just menstrual cramps or all of these stress related symptoms. And magnesium is like an important cofactor for so many processes in our body, including making neurotransmitters. And it's just like drained by stress, right? So that can be very helpful. And then electrolytes. So many people that I've worked with are like, I was drinking so much water, but I didn't realize I was dehydrated, right? And you just add a little bit of electrolytes to your water throughout the day, and you're going to have more energy. You're going to sleep better. You're going to have less cramping in your body. So these are probably like the foundational things that I would recommend for people with like adrenal dysfunction and all the stress symptoms, right? You have tension in your body. Like magnesium can help. Like, please consider that, or an Epsom salt bath.
Yeah, it reminds me a lot of farming and mineral salts. We put a salt lick out for our cattle.
Yeah.
They eat lots of greens, right? I mean, they eat all the greens you could imagine. They're eating grass every day, but as their breakfast, lunch, and dinner, and everything in between. But they need that salt. And, humans used to get salt. We used to have, most of our foods in the wintertime were preserved with salt. This was prior, a lot of the food, antioxidants and other chemical ways of preservation that were created. And so we've kind of lost our way with even implementing salt. And doctors have really demonized salt as a trigger for blood pressure and cardiovascular disease. And what I hear you saying is that which is what electrolytes are, right? It's salt. In a nutshell, I mean, sea salt would work, and Himalayan salt would be a great source of mineral electrolyte as well. But just adding that back into the diet can be such a profound thing. And at least I've seen that be the case. And not just in humans, but also with my farm animals.
It's incredible. And whenever I go to farms, I'm like, how did these animals find this little salt lick? How do they know just to lick it out, right?
It's interesting. We do something where we have it's like a buffet. It's like a built-out buffet for a cattle, where each canister contains a different mineral, and it's just powdered minerals that we put out. And there's about 20 of these different things that we put out, and the cattle will take what they need. They will come up, and sometimes they'll lick the zinc aggressively, and sometimes they'll leave that alone for a while and they go to the selenium aggressively. But there's like an intuition that they have, and it's called free choice mineral, free choice in cattle, and that's the way we do our mineral supplementation, along with just a pasture rock salt that they can lick on. But they're very intuitive, and I think, again, we're going back to what we were talking about before, is listen to yourself, listen to your body. Your body sends you messages if you're open to receiving them. If you're not open to receiving them, then and you're more interested in other people's messages about what you should do, then I think that's where a lot of folks get in trouble.
Yeah, I guess cows don't watch a lot of media, so they're probably just into their own messages. It's so interesting. When I was first new mom and I was looking at baby-led weaning, it talked a lot about babies intuitively choosing the right kind of foods for them, right? So if a baby was low in iron, they might gravitate more towards the liver, and so on and so forth. And, we see the same thing in adults. If they're craving salty foods, and I call this, I just ate a whole bag of chips syndrome, there's a chance that you probably have some sort of adrenal dysfunction and you need electrolytes. And maybe don't eat a whole bag of chips, but why don't you consider doing something like Soleil, where you can take a cup of water and add some sea salt in there, which has various vitamins and minerals, and you sip on that throughout the day, or add extra sea salt or perhaps some electrolytes into your food. And that's just incredible to me. Or people that are craving, caffeine in the morning, it's like you probably have low cortisol. And so you're self-medicating. People that are craving wine in the evenings, it's like you probably have high cortisol in the evenings and you have a racy mind, and you're self-medicating with that alcohol because that helps you make some GABA. But, you can take GABA directly, or you can take magnesium, or you could take L-theanine. All of these things can help you, make your own medicine internally, right?
Yeah, amen to that. So one of the other things you talk about in your book are essential oils. And I know those are quite popular these days for a lot of people, just for home remedies and home use for a variety of different things. But you actually talk specifically about some of your favorites. Can you go through a few of those and kind of what a person can do or take in regards to their adrenal function?
So I really love lavender. I think it just smells so beautiful. I think everybody has heard of lavender. It's not hard to get. And this has been shown to help raise oxytocin levels. And this is one of our love hormones that helps to take us out of that fight or flight state into more of that thriving and safe state. It's kind of, they call it the love hormone. I also think it's a safety hormone. So utilizing that throughout the day, whether that's in a diffuser, whether that's doing it with carrier oils or spraying it on your pillows, this can be incredibly helpful for a lot of people. Clary sage has also been studied to raise oxytocin levels. I don't particularly like the smell of it as much, but this is just a really great way to put yourself at ease through essential oils, where perhaps you've had a stressful day and you don't really know how to unwind. Having a little bit of having a nice little stressful roller can help. My 4-year-old son, we make little essential oil rollers, and we were going to a family gathering, and he's like, "You seem stressed out. Let me put my roller on you. Let me put this on you." And he was giving everybody his relaxing essential oils. It's not like a Xanax or anything that'll wear you out, but you really do feel the effects of them, and they can be incredibly helpful for just getting into that more of that safety zone.
I mean, what you say is it's not Xanax, but if you apply all the things we're talking about, right? You maybe apply some of the supplementation, you apply some of the essential oils, you apply some of the behavioral changes, sunlight modulation, sleep-wake cycle, changes of diet, all these small things add up to be big things, right?
Yeah, and absolutely. And I find from an anxiety standpoint, when I first was diagnosed with Hashimoto's, I had panic attacks and crazy levels of anxiety, and balancing my adrenals was the key to overcoming that anxiety. So I had panic attacks. I was in the bathroom crying kind of panic attacks. I haven't had one of those in over a decade. And part of that is that adrenal balance. So even for people that are thinking this is just who they are, I'm just an anxious person, right? You don't have to be that way. There's a good chance that anxiety is coming from a blood sugar issue. Guess what? When you become hypoglycemic, that's when your body feels anxious, or when you release a lot of cortisol, that can be when your body feels anxious. And that message, a lot of times, yes, it can be past trauma in your life. Yes, it might be things that you need to work on from that perspective. And I do talk about some of the deeper root causes, but there's a really important physiological aspect of it that for most people, when you balance the blood sugar and you take some of these supportive nutrients, you're going to feel a lot better, and you're not going to you're not going to have those panic attacks. We have more than an 80% success rate with anxiety resolving or getting significantly better just throughout the 3 to 4 weeks on the program.
That's wonderful. What else can we talk about that you think would be low-hanging fruit? Or I know that's a big question, right? What else, right? Because there's probably a billion things that we could go into nuanced detail over, but are there anything else any questions I haven't asked you that you feel like would be just very valuable for the audience today if they knew the answer to?
I feel like anybody struggling with brain fog, the program is very helpful with that. We have about 92% of people getting better with brain fog. And there's a lot of aspects of the program that help with that. The blood sugar balance, the adaptogens can help. Sleeping better at night can help. Spending time in nature and sunshine can help with that. But I feel like one of the biggest needle movers, in my opinion, is actually using carnitine. So this is, I generally recommend a mix of L-carnitine, which is really helpful for muscles, and then acetyl L-carnitine, which is very helpful for the brain. And I find that this is incredibly helpful for fatigue and brain fog, where people will say, I started on this and my brain just awakened within a few days. So this is something that I would highly encourage for people to look into if they're struggling with brain fog or fatigue. This can be helpful for a lot of things, for muscle pain, for helping people who are have thyroid fatigue. It's been studied in that, and for helping with weight loss, because it helps us utilize our fatty acids and helps us, somebody, maybe has trying to lose weight and they are in doing a keto diet. The carnitine can be helpful for that as well, to helping people tolerate eating more fat too.
Yeah, that absolutely. I've seen that a lot in patients that are, trying to follow like a ketovore or a keto diet for weight loss, where we test their carnitine levels and they're on the floor and they're struggling. And carnitine supplementation I've seen be real helpful in those cases. So that's good. That's really good advice. Do you have time for a couple of questions? I have a few audience questions that people have written in about.
I would love that. Hopefully I know the answer to them, right?
You can always decline to answer if you don't know it. It's, we call part of our segment on our show is Pick Dr. Osborne's Brain. And so people just launch their questions relentlessly at me for, 30 minutes. And I don't know the answer to all of them, but it sure makes you want to know the answer to more. But so here's our first one. Tiffany wants to know kind of the impact of long-term versus short-term stress on health. Is there something that's different about the two?
Absolutely. So in short-term stress, we go through the process and our body makes more cortisol. And you think about people that are like, they see a child under a car and they get this super strength to like lift up the car. And that's our stress hormones, adrenaline and cortisol and all these things kicking in to help us power through that difficult time. And then we kind of walk it off, we shake it off, maybe we get more extra rest. And then our stress hormones go back to a healthy circadian pattern after that. So this is sort of what our body, I feel like, has been designed to do. This is kind of the ideal use of our stress response. What gets really tricky with chronic stress and prolonged stress is that we end up having this adaptation process where, yes, you make more cortisol at first, and eventually that cortisol production, cortisol is a catabolic hormone. And so it starts to break down your tissue for fuel. And so you might see people that are like, I'm losing muscle mass and I'm gaining weight. What is happening, right? And with time, if you don't address the chronic stress, you're going to start seeing alterations in that cortisol pattern. So typically in the beginning, it's like stress equals high cortisol. As time goes on, the stress input is going to adjust our cortisol to the point where we're going to have, trouble waking up in the morning because our body's going to say, okay, we need to do something about that. And the feedback system gets altered or adjusted. And unfortunately, once we start suppressing that cortisol production, when in my experience and understanding, more inflammation can go unchecked. And so if that process goes on long enough, sometimes it's a year, sometimes it's 5 to 10 years, the person gets stuck in this chronic stress response and they end up with an autoimmune inflammatory condition, Hashimoto's thyroiditis, rheumatoid arthritis, ulcerative colitis, and they end up with perhaps the low levels of cortisol that their body isn't really repairing itself, because we need kind of just the right amounts of cortisol to get into a repair state. So I typically see people that are, again, in that catabolic process, and they're breaking themselves down to fuel the stress. And we really have to work on shifting that to be like, let's thrive, let's rebuild. And protein's a part of that, and everything else that we talked about is getting more into that thriving state.
Well, on that same note, what do you think about, a lot of doctors just prescribe corticosteroid, right? To just put patients on low dose 2.5, 5 milligram steroid. And they feel remarkably better. Good idea, bad idea, in your opinion?
It's one of the things that I'm all about, helping people and helping them feel better. And I think this is if you're in a lot of pain, or if you're somebody that's got super low cortisol throughout the day. I've seen people with like a cortisol level of like 6 or 10 or something throughout the day. Then perhaps that might be something to help short term. I would still work on all of these other things that can help you get through, really adjusting your circadian cortisol production to the healthy levels so that your body can manage that inflammation. When we take steroids for a long time and in doses that are high, then that actually can further suppress our own cortisol production. And you can actually have a type of Addison's from suppressing your own cortisol production for being on steroids for too long. You can suppress your pituitary axis like that. So generally, I'm like, you can do it short term and then try not to use the hormones at bedtime, because that is especially when they can be problematic for suppressing your HPA axis. So I have had people, unfortunately, with that happening with like even low dose hydrocortisone and even with adrenal glandulars, which I don't think a lot of people are aware of, but that can happen. And then, steroid creams for rashes, right? So I know, being a pharmacist, I'm always like, this is actually in the package insert that this can happen, where not a lot of people have an appreciation of that happening. So that's kind of a long-winded answer. So I would say, like, if it helps, do it, but also please know that there's other ways to do it that will help your body do it on its own.
Well, and I like what you said there at the end too about, your experience being a pharmacist. How often do people sit down with a pharmacist or their medical doctor and get informed consent about the side effects or the potential downfall of the medicine? Most people I see that are polypharmacy cases, 5 or more drugs, nobody ever got sat down and said, hey, that steroid for you long-term is a bad idea because it causes bone loss and you are already osteopenic. Or that steroid long-term causes diabetes and you're already pre-diabetic. So for you, that's probably not the best choice right now. And so then what they end up doing, at least in my experience, is they drive them into further disease states with the use of pharmaceutical intervention, with the idea that they're trying to be compassionate and help that person's pain or help that person's problem. But I think people would make an intelligent decision about their own risks if they were just better informed.
Mm-hmm. Absolutely. I have seen, unfortunately, drug-induced disease too many times, even as a new grad pharmacist in my 20s, when I was working as a consultant pharmacist, going into people's homes who were on polypharmacy meds. And I would look at this person, I'd be like, why are they on so many meds? And sometimes it was like, this person fell and they think they had a seizure. So they put them on a seizure med, which then led to this side effect. So then they got put on this med, and it was like this prescribing cascade, right? Maybe in the case of an inflammatory condition like rheumatoid arthritis, you might find some relief from that short term. Please note that there are other things to do to lower inflammation in your body. So going grain-free, having like the autoimmune paleo diet. This can be incredible. Finding the root cause of, why you have inflammation in your body. Sometimes it can be a gut infection, right? Sometimes it could be exposure to mold toxins. There are so many different things that I feel like from a root cause medicine, we look at where conventional medicine doesn't. And it's unfortunate because people can get stuck on this cycle.
Yeah, I absolutely agree. Another question. This one is about Addison specifically. Are there things, so this is from Vanessa, I have autoimmune Addison's disease. How can I cure that and get my life back? Big question, right? How can I cure my Addison's disease? What's your take on Addison's?
So, and just in full disclosure, for a person with Addison's disease, this is when a person has 90% of their adrenal glands that are destroyed by the autoimmune process. And so they're not able to produce their own cortisol or perhaps mineral corticoids as well. And that, it's a lot easier to prevent autoimmune damage than to heal it, right? So at that point, I would definitely recommend working with an endocrinologist and getting some replacement hydrocortisone or mineral corticoids, because your body is presently not making them. So that's an important consideration. Looking at figuring out, do you have any autoimmune triggers? That would be something that I would recommend working with a functional medicine doctor. So going through and doing a gut test, like a GI map test, doing something like an organic acid test, mycotoxins test, and doing some investigative work to see if there's anything driving that autoimmune process. I haven't had clients with Addison's disease. I have had a dog with Addison's disease, and some of the things that really, not giving like veterinary advice here, but definitely changing his diet was very, very helpful for us. He has since passed, but we made homemade lamb for him, which did not smell great every 2 weeks, and just really focusing on your nutrition and trying to manage the inflammation from the places where you can is what my advice would be for that particular person. We did try for Hashimoto's, low-level light laser therapy over the thyroid gland may restore thyroid function, and people have had success with that. We did try low-level laser therapy for my dog's adrenal glands. We did not have success with that, but that might be something to talk to your doctor about to see if that might be helpful or appropriate for you. Again, I don't want to give medical advice, and of course, I want people to follow along with their practitioner, but definitely from functional medicine standpoint, I would look at what sources of inflammation might be with Addison's.
So in summary, measuring potential drivers or triggers for the underlying inflammatory root of the autoimmune reaction itself.
Yeah, I really love utilizing like antibody testing, because antibody testing can uncover, in the case Hashimoto's is my specialty, and a lot of times when people come to me, they're already on thyroid medications and 80-90% of their thyroid gland has been damaged. And so at that point, we're really focusing on giving you a full life while you're on medications and getting rid of all of your symptoms. In some cases, if we find the antibodies and maybe there's just a little bit of thyroid gland damage, if we can lower the antibodies and the inflammatory immune response, then the person may not need meds. But again, it's so much easier to prevent that damage than it is to try to repair a damaged organ, unfortunately.
Okay. Next question. Are there roles for other hormones like estrogen as it relates to adrenal function? Like, is there a feedback or anything that estrogen specifically plays a role with? And I think this question is, the premise of it is, I'm a woman, I'm going through menopause. Not me, I'm not the woman, right?
Oh, you're not.
Well, I could be in today's world, but no. But the premise of the question is, that lower estrogen as we age, does that have an impact on how we produce adrenal hormone?
So, so when we think about how our hormones are produced, all of them are produced from cholesterol, and they go through by our adrenal glands, and they go through this cascade. And in my experience, women going through menopause, they typically will have lower levels of progesterone first, and even and then as their estrogen starts to decline, even though they might have lower estrogen overall compared to like what a 25-year-old woman might have, they still might be in a bit of an estrogen dominant state. So I would really work on looking at your estrogen and progesterone ratio and working with a practitioner on that to see if you can get that better into balance, because some of the symptoms women experience might be due to that estrogen dominance. The other thing that can happen with people who are in this adrenal dysfunction state, their body will prioritize making cortisol rather than DHEA or progesterone or estrogen. Progesterone is usually the biggest one to suffer. So typically the women that maybe were getting by with like living a very stressful lifestyle before perimenopause, before menopause, they really have to be extra mindful during that perimenopause and menopause time of their adrenals, because, and I always have to double check the stats because it's incredibly high, but after menopause, the adrenals take over the production of our estrogen and our progesterone from the ovaries. And I have it in my book, but it's something like 80% of the production then goes to the adrenal glands. And so supporting your adrenal health and your optimized adrenal gland hormone production can help you have a much smoother time during menopause and perimenopause.
So if I am kind of recapping that, a woman going through menopause who has a reduction of estrogen, progesterone, and she's stressed,
yep.
Her adrenal glands, because they take on that role, a big part of that role after menopause, she's going to be more susceptible to that reduction, not only in sex steroid hormones, particularly progesterone, but also to mitigating and producing adequate cortisol if she's already been under tremendous stress. So it's like a double hit.
Yeah, absolutely. And if she has a thyroid issue, then that's like a triple hit too, right?
Yeah, for sure. What in those particular types of cases, I mean, just your opinion on hormone replacement therapy, biological like Biest or progesterone, do you have an opinion on those?
I have found like bioidentical progesterone can be very helpful for a lot of women. And so I'll say like my adrenal transformation program will help 80% of people feel better, sleep better. If they happen to be low in progesterone, that might actually be the missing piece for them. So doing a little bit of topical progesterone if they're in that perimenopause, menopause state and they're having trouble sleeping at night, they're anxious, they're irritable, they're gaining some weight, sometimes progesterone might be extra helpful to kind of support the hormone from pathways from like, this side and this side and that side. So you kind of get results much quicker. Of course, I recommend working with a practitioner on that. And then as far as like the other hormones that are bioidentical hormones, I feel like they can be helpful for some women. I do definitely recommend going through testing and working with somebody rather than like ordering supplements online for that.
So test, don't guess.
Yeah.
And are there side, you mentioned progesterone just kind of topically, which many can just buy over the counter. Are there side effects that you would say if it's wrong for a person, for example, would there be certain side effects that you would warn for them to watch out for if they're taking it and they don't actually need it?
Yeah, like with all of the hormones, so you can have excess bleeding, you can have some bloating, some people might get too emotional with it. So you definitely want to make sure that you're working with a practitioner. It's interesting because there's a lot of different opportunities and protocols for using progesterone. I really like the book called Adrenaline Dominance, where they use high doses of progesterone for people who are kind of in fight or flight state. And then at the same time, I'm just trying to be careful about hormones, because one person's like ideal dose might be too much for another person. And so my focus usually with my work is, how do you support the body's production of these hormones naturally? So like magnesium and B6, for example, and vitamin C, which are part of the Adrenal Transformation Protocol. And then a lot of the stress reduction activities, they can help you make your own progesterone naturally, right? And then there's seed cycling that can help you do it naturally. Then after a certain age, you may wish to like test your levels and really adjust to that testing. And I feel the same way about using things like pregnenolone and DHEA, which can be really big game changers for people supporting their adrenals, but it's only if you've done the right testing and can get the right dose of them.
Gotcha. So monitoring is important. And first and foremost, do the things as naturally as you can to see if your body can do what it knows how to already do, right?
I would say, yeah, like within, the program is 3 to 4 weeks. And the reason why I wrote the book and I designed it so people can do it without doing like testing is because you were just chatting about this earlier, but I was working with clients and I could do their tests for them and then determine like their dosages of what they needed. And some clients that I've had, and I just was laughing today because I have a lab test portal that I only now use for family and friends, because I go through Rupa for everything, but somebody had ordered a test through it. And I was like, why is this person showing up? And sure enough, it was a person that, got a test kit from that portal like 5 to 6 years prior. And so they were just doing the test. And so there's a lot of barriers to doing some of the functional medicine tests. One, you ask your doctor to order cortisol for you. You go to an endocrinologist and they do a blood test when you really want to do either a saliva test or a urine test for accurate results. And so some people might have to find that practitioner. And they're like, where is my, who do I go to get these tests ordered? Then they go to the practitioner and the tests are out of pocket. So perhaps they're like, I can't afford this. Or maybe they do get the tests and they get them, home, but then they just sit on a shelf for months, sometimes years. And so for me, I'm like, there's a lot you can do with just pure lifestyle before you reach for doing some of the, functional medicine testing, which I personally love, which I personally would do with like anybody I do on myself 10 times a year. But at the same time, my focus is really to empower people with like very solid and practical lifestyle solutions that they can do, with the supervision of their doctor, of course, but they can also generally do them safely and really educate and empower themselves on how to take charge of their own health.
Yeah, I can't thank you enough for being out there and being an education advocate for people, because I don't know, I'm pretty biased about this. Maybe you agree, maybe you disagree. I'm not putting you on the spot, but medicine is a complete and utter failure, in my opinion. And not to say that all medicine is bad, or that all things that any medical doctor or that any hospital have ever performed are evil or bad or intentionally evil. But I think also that the phraseology, the road to hell is paved with good intent. So much gaslighting happens. So much lack of science occurs in a doctor's visit. So much pharmaceutical influence. I mean, tremendous amounts occur. And if you look empirically at the data on medication and on mainstream medicine as a tool for health in any industrialized country, but particularly in the US, it's the third leading cause of death. It's the most expensive care that we could deliver. Last year, it cost $3.2 trillion. And we lost more people last year than we ever have. And we're spending more than we ever have. We've now made healthcare a right instead of an obligation that a person has to take care of themselves. We've said now as society, we're we're going to pay your bill if you neglect yourself indefinitely, and your doctor allows you to neglect yourself by being too lazy to have the right conversation to empower you about doing the right things so that you can take on personal responsibility for your own health. I think all those things together combine to make what has become medicine, and what I said earlier, a complete and utter failure. So again, I really do appreciate your work and what you've done to help empower people. And I've got my copy right here. And so for any of those of you watching who are struggling with chronic stress, who are struggling with trying to figure it out, I think the book is very much well worth the read and worth an attempt. It's a 4-week protocol, and it's a super easy to apply protocol. It's not like we're not trying to move mountains and change everything about everything you ever did, but it might just help you get over the next hump and make some self-observations that could be down the road life-changing. So that's my take. I just thank you for being here, and thank you for taking time. I know you're super busy, and I always appreciate your input, and always appreciate your candor to share.
Thank you so much for having me. I love your work, and I love how you advocate for people and share your brilliance with us. I always learn so much whenever we get a chance to connect. Really appreciate you having me on.
Well, you're very welcome, and I look forward to having you on again in the future. Until then, you have a fantastic day.
You as well.
Thanks for tuning in to the Dr. Osborne Zone. Don't forget to share, like, and subscribe for more content like this, and make sure you come back next Tuesday at 6 p.m. Central Standard Time and Thursday at noon 30 for more episodes.